Hi everyone. Today we will be talking about tympanic membrane. There is a little bit of change in the strategy with which I wanted to go ahead. So initially I thought I will cover only the essays, the big ones, the ones that are tough like that. But then the suggestion of somebody suggested that no, let us start with start with year from the first chapter and cover all the important topics. Cover all the important topics, whether they are shorts or whether essays, and go complete the year, then go to nose, then complete the nose, and then go to throat. Like that, that may probably give a better continuation to the students and maybe more useful to a ENT going student. So they are like totally new to ENT, so better to start from here. So there's a little bit of change in the strategy. Before this, I covered a lot of big topics, essay topics, important topics. Now I'll be talking shorts. I will not be talking the entire book will be not be talking. What is important? Because this is where I made a mistake as a student, where I was like, dive headlong into the subject where you are not don't know what is important, what is not important. So let us know what is important. Our first goal is to pass the exam. In my opinion, first goal is to pass the exam. Once you pass the exam, later we can see how much subject you can retain. Okay, so as part of it, we are starting with tympanic membrane, which is an important topic. It has been asked twice, once in March 2011, another time in 1996. Now coming to the location of the tympanic membrane, where is it located? It is located between the external artery canal and the middle ear, obviously. So this is the external artery canal. As the external artery canal goes inside, then we have the tympanic membrane. Behind the tympanic membrane is the middle ear. The middle ear is connected to the nasopharynx, to the eustachian tube. Behind it, you will have the cranial, that is the inner ear. That is the cranial, the cochlea, the vestibule, the 8th cranial nerve. Okay. So this is the tympanic membrane. It forms a boundary between the external artery canal and the middle ear. So it keeps the external world away from the sensitive part of the middle ear, where you have the malleus, incus, and stapes. Okay. So what is to be understood? It is present at an angle of 50 degrees to 55 degrees to the horizontal. So it is not present at an angle of 90 degrees to the horizontal. It is not present at an angle of 90 degrees. It is present at 55 degrees to the horizontal. It is slanting towards the external ear. It is slanting towards the outside, laterally. It is slanting towards the laterally. When it slants towards laterally, when you see the tympanic membrane like this, this is the anterior-inferior part. So anterior-inferior part is more medial compared to the posterior-superior part. So posterior-superior part of the tympanic membrane is more closer to the laterally than the anterior-inferior part. That is what it means when you are at a 55 degrees to the horizontal. It is slanted. So it is slanted. Okay. So when you look at the tympanic membrane, when you try to reach the tympanic membrane through the external artery canal, suppose this is the external artery canal, this is the posterior superior part, this is the anterior inferior part. So the behind it will be the middle ear. So this anterior inferior part is more medial, more far away from the external artery canal than the posterior superior part, which is more nearer to the outside, more nearer to the external world, or this is more away from the external world by a few millimeters, of course. But it is the point of this is it is not present at 90 degrees. It is present like this. Okay, this is the floor of the external artery canal, this is the roof of the external artery canal. It goes like this. But I am like giving you a cross section so that you can understand this way also. So it is obliquely set, so that the posterior superior part is more lateral. As I said, posterior superior part is more lateral than the anterior inferior part. What is the color of the tympanic membrane? Color of the tympanic membrane, we describe it as pearly white in color. When the tympanic membrane is normal, it will be shining. That is called a cone of light, and also you will be having that characteristic pearly white color. Okay, it is divided into two parts. The lower part is called the pars tensa, the above part is called the pars flaccida. Okay, now coming to pars tensa. Pars tensa is firm and tense. This is where the vibrations are picked up by the tympanic membrane and they are transmitted to the malleus, incus, and stapes to the inner ear. Okay, so it is firm and tense. Why is it firm and tense? Because the middle fibrous layer is well developed in pars tensa. It is very well developed in pars tensa as opposed to not so well developed in pars flaccida. Okay, now coming to the other part of the pars tensa. This is present only in pars tensor. Please understand the tympanic annulus. If I draw a tympanic membrane like this, and then it means that it appears as if there is a annulus all over. No, annulus is not present. Annulus is present only in the annulus is present only in the pars tensor region. In the pars flaccida, there is no annulus. The annulus is what is annulus? The middle fibrous layer, as it goes peripherally, it forms a thickened kind of a thickened ring, which is at the periphery of this pars tensor. It fits into the tympanic sulcus. Now, the bone of the external auditory canal, as we go medially, where the tympanic membrane is supposed to be there, we have a like this, if you're coming, suppose this is the external auditory canal, as we are doing the surgery and going inside, we will find that there is a groove. Okay, that is the tympanic sulcus. That tympanic sulcus is which houses the tympanic annulus. It is firmly attached, and when we want to do a meninoplasty and go into the middle ear, we have to pass through this tympanic annulus, push it and go inside. Okay, the tympanic annulus is a clear-cut structure when we try to do surgery. Okay, tympanic annulus. So periphery of the tympanic membrane is thickened from a fibrocartilaginous ring, which is present only in the pars tensor. Do not confuse it. It is not present in the pars flaccida, and it fits in the tympanic sulcus. As I said, it's a groove on the bony part. This is the bone. Okay, the external auditory canal bone. The medial part is bony, right? The lateral part is cartilaginous. So it fits inside this umbo. Umbo is a central part of pars tensor that is tented inwards at the level of the tip of the malleus. As you can see, the handle of malleus is not straight. Handle of malleus is not coming like this. Handle of malleus is going inside. So this is, 1 minute, let me redraw it. So the handle of the malleus is not at right angles. Again, it is like this, handle of the malleus. So because of the action of the tensor tympani, the handle of the malleus is pulled inwards, because of which the tympanic membrane will appear like this. This is the handle of the malleus because of the action of the tensor tympani. This is the external auditory canal. This is the external auditory canal. So if you look at it, this is the middle ear. Okay, this is the handle of the malleus. It is enclosed within the fibrous layer of the tympanic membrane, and when it is pulled backwards, you will have a tenting of the tympanic membrane, and it appears tight so that it can vibrate well. Okay, cone of light. It extends from the umbo to the periphery. This is called the cone of light. If the tympanic membrane is normal, cone of light will be bright. Okay, periphery of the pars tensor to the anterior-inferior quadrant. Coming to pars flaccida, it's also called the shrapnel's membrane. Pars flaccida is also called shrapnel's membrane. Location, where is it located? It is located above the pars tensor. What are its boundaries? This part of the bone that is present from here to here. Okay, that is where the external auditory canal is changing into the middle ear in the superior part. That is called the notch of Rivinus. Okay, notch of Rivinus. So this part that is present above the pars tensor is called the pars flaccida. It is present between the anterior malleolar fold and the posterior malleolar fold and the lateral process of the malleus. This not so bright looking structure is the pars flaccida. Okay, is situated between the lateral process of the malleus, between the notch of Rivinus and the anterior and posterior malleolar folds. It is loose and flaccid, as in the name suggests. It is loose and flaccid. Why? Because the middle fibrous layer is not as properly arranged as in pars flaccida. Okay, as in pars tensor. Pars tensor, the middle fibrous layer is tense, and when you look at the tympanic membrane, when you touch the tympanic membrane with some instrument, you can something pushing back. So that is like it is taut. But the same thing is not the case with pars flaccida. We use the word landmarks when we come to tympanic membrane, because you know what is where when you want to describe something. Okay, what are the things that you see? You see pars tensor, you see pars flaccida, you see the anterior malleolar, this is the anterior malleolar fold, this is the posterior malleolar fold, this is the long process, the handle of the malleus, this is the handle of the malleus, this is the lateral process of the malleus. Okay, then handle of the malleus, lateral process of the malleus. Then you have the umbo, the tip of the handle of the malleus, which is tented inwards. It's called the umbo. This is the cone of light. Okay, this is the cone of light. I talked about the anterior and posterior malleolar fold. Sometimes in the posterior superior quadrant, you can see the shadow of the long process of the incus and the stapes, and sometimes you can see the shadow of the round window. So all this you'll be able to see in the landmarks of the tympanic membrane. Now coming to the layers of the tympanic membrane. Tympanic membrane has 3 layers because it is developed from all the 3 embryonic layers like ectoderm, mesoderm, endoderm. Okay, this is also an important question from the NEET PG point of view. So this is the external outer epithelial layer of the tympanic membrane. It is continuous with the epithelial layer of the external auditory canal. So the epithelial layer of the tympanic membrane is continuous with the epithelial layer of the external auditory canal. The endothelial layer of the tympanic membrane is continuous with the endothelial layer of the middle ear or inner ear cavity. Endothelium, also called the mucosal layer. The mucosal layer is continuous with the mucosa of the middle ear. Okay, the middle fibrous layer encloses the handle of the malleus. So here you have the handle of the malleus. This is the fibrous layer. So suppose this is the handle of the malleus. The fibrous layer encloses this handle of the malleus. And you have the outer epithelial layer and the inner mucosal layer. This is continuous with the external auditory canal. This is continuous with the middle ear. This fibrous layer is well developed in pars tensa. Okay. Coming to the applied anatomy. Whenever you write an answer, try to write a few of applied anatomy points so that the examiner knows that you know something, what to do with this anatomy. Okay. So these are 3 important questions from the NEET PG point of view. I just included it. This is not applied anatomy. You can call it to some extent. Tympanic membrane develops from all the 3 embryonic layers, that is the ectoderm, mesoderm and endoderm. Okay. So one of the questions is total surface area of the tympanic membrane is 90 millimeter square. This whole thing is there. This is 90 millimeter square. But because the center is attached to the umbu, the central part is not as freely mobile as the peripheral part. The peripheral part is more freely mobile. So that comes to 55 millimeter square. The effective vibratory area of the tympanic membrane is 55 millimeter square. Okay. So pars flaccida is flaccid. So it's more susceptible to retraction when pressure in the eustachian in the middle ear becomes negative due to eustachian tube blockade, leading to primary cholesteatoma. So pars flaccida, as we already talked, the middle fibrous layer is not so properly developed. So when suppose this is external auditory canal, tympanic membrane, external auditory canal, tympanic membrane, middle ear and eustachian tube. Eustachian tube is getting blocked. So there is negative pressure. So the tympanic membrane also gets retracted and the pars tensa gets retracted, pars flaccida also gets retracted. But pars tensa is tighter, so it's not going to retract easily. Pars flaccida, you will have a retraction pocket. So how do you denote it? There is a retraction pocket here. The retraction pocket, it is going inside, you can see it. This is the retraction pocket here in this case. From here the retraction pocket is going inside and you can see this whitish bulge. This is most probably cholesteatoma coming from the superior part going into the, it may be going into the attic also, but here you can see in the posterior part of the tympanic membrane. So this one, if you see an attic perforation, always think of atticoantral disease. Always think of unsafe type of CSOM, as we are going to cover as the syllabus progresses. So pars flaccida is more flaccid, so it is more susceptible to retraction when the eustachian tube gets blocked and there is retraction. One more thing is, as we observe clinically, even in mild disease of the tympanic membrane or of the middle ear, suppose there is otitis externa, external auditory ear problem, otitis externa, or middle ear, some kind of serious otitis media, some kind of retraction, cone of light, which should be perfect, sometimes disappears totally or it may become distorted. So when it is getting distorted or it is getting disappeared, it means that there is some disease and you need to investigate. If you don't see the disease right on doing an otoscopy, you don't see it, you should investigate further. When cone of light is lost, be sure that there is some other problem. Okay. Now coming to perforations. So the pars, this will definitely talk in CSOM, but to add it in this applied anatomy part made sense to me, so I have added it. Suppose there is a perforation. Suppose this is the pars, this is the tympanic membrane, this is the anterior malleolar fold, posterior malleolar fold, and this is the handle of the malleus. Suppose there is a perforation in the middle where it is surrounded on all sides by the tympanic membrane. This is called a central perforation. This is one of the most frequent things that you see on a day-to-day basis. Suppose there is a retraction here, suppose there is a perforation here. This comes to unsafe type of CSOM. It's called attic perforation or attic retraction, and this indicates that it is an unsafe type of CSOM. Sometimes you can have a, you can have a marginal perforation where the annulus is destroyed, and the all this side there is tympanic membrane. On one side there is a bone, directly bone is there. This also indicates that we have to look for articuloantral disease. This means there is articuloantral disease unless proved otherwise. So you have to have a knowledge of this. Okay. So this is what it is. So this is what I talked about. If there is a perforation, the pars tensa, you call it central perforation. It's a safe type of CSOM. If perforation, the pars placida, attic perforation, think of unsafe type. Fibrous annulus gets damaged in the posterior superior quadrant, think of unsafe type. This is called a marginal perforation. Okay, with this we come to the end of the tympanic membrane short notes. So just have a quick recap. Location, it is present at 55 degrees to the horizontal, so the posterior superior quadrant is more lateral. Color is pearly white in color. Two parts, pars tensa and pars placida. Now coming to pars tensa, it is firm and tense. You have a structure that's called tympanic annulus, then you have the umbo, then you have the cone of light. Okay, then in the pars placida you have the anterior malleolar fold, the posterior malleolar fold, and the notch of Rivinus, and then you have this space that is present in between. This is called the pars placida. Pars placida is like 1/3 of the tympanic membrane, and the pars tensa is 2/3 of the tympanic membrane. Okay, these are the landmarks that I talked about. Then it is made up of all the three germinal layers, as we said, ectoderm, endoderm, and mesoderm. So that are these three layers. Now coming to the applied anatomy, I think if you can say pars placida is flaccid, so it can lead to primary cholestoma. If you can include one point, that is fine. If you can include this second point, that is even great. If there is mild disease, also cone of light disappears. Other things are a little bit more. Now, these three things you have to remember. You develop from all the three embryonic layers, and this 55 millimeter square is there. It is the same as the angle of the tympanic membrane. So this can be a neat PG question. Thank you so much for the patient listening.